In Bungoma County, the Ministry of Health, in conjunction with Amref Health Africa, are training people with disabilities to be part of the community health workforce so as to reach to the massive numbers that have been suffering in silence. According to Amref Africa Operations and Delivery Lead Peter Ochieng, service access has been a thorn in the flesh for the people living with disabilities, and the community health workers living with disability will help reach out to that group directly.
In Bungoma County, we have trained 10 community health workers who are going to be connected to link facilities and are going to reach people who have not been reached before. Because what we are saying is that we are going to have a primary healthcare approach in order to achieve UHC and leave no one behind.
Dr. Lukorito, on behalf of the County Health Director of Bungoma County, said the special group will break down barriers and aid in the fight against communicable diseases, but most importantly, the deadly beast, cancer.
The people living with disability within our society have not been able to access health because we don't have a way of reaching them. So today we have chosen to train people living with disability so that they can talk to them as peers.
We meet El Kasanya at Milo Health Center in Webuye West Sub-County, Bungoma County, trying to access health services. She says that mothers living with disability in rural areas have had a challenge while giving birth because the health facilities available are not disabled friendly.
When it comes to maternity, wanawake wa kujifungua wanapata vigumu, wanapata wakati mgumu kujifungua, hasa mambo na vitanda ziko friendly to them. Wengine hawawezi kupanda kwa hizo vitanda, sasa wanashindwa wafanye aje.
Caroline Wangamati, wife to Bungoma Governor Wycliffe Wangamati, says that despite numerous efforts by both the national and county governments to boost access to health service delivery, a lot more still needs to be done.
We need to identify the gaps and then do something about it. So for as long as we take the step of faith and start addressing it and making it more comfortable, Rome was not built in a day. So where I sit, as long as we are deliberate and we are putting in steps to address that, then it is okay.
Salome Obuaya, the coordinator disability mainstreaming for Health Bungoma County, says early intervention and rehabilitation is key, and improving infrastructure and attitudinal culture between healthcare workers towards people living with disabilities will build confidence and trust between the two groups.
We are trying to break the barriers of communication. At least we have trained healthcare workers on sign language. We are improving our infrastructure and also trying to educate healthcare workers on rights of persons with disabilities.
The inclusion of people with disability to be part of the community health workers is just one way of ensuring that the people with disability get quality health services. John Makuba, K24, Bungoma.